Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of chloroquine and COVID-19. We have questions and answers. What is chloroquine? The chloroquine is a synthetic 4-aminoquinoline anti-malarial drug. It is used against malaria. Malaria is a parasitic disease that is transmitted by the mosquito. What are the therapeutic indications of chloroquine? Chloroquine is not only used for the treatment of malaria, it is also other indication. Let's start. Treatment of erythrocytic Plasmodium falciparum malaria and Plasmodium vivax malaria. It is more effective in Plasmodium falciparum malaria. It is comparatively less effective in Plasmodium vivax, but in certain part of the world, Plasmodium falciparum becoming resistant to chloroquine, we have alternative medication. Treatment of extraintestinal amoebiasis, like the amoebiasis that is caused by a protozoa, that is the parasite protozoa, that is the Entamoeba histolytica. So it is not only confined to the intestine, it may also infect the lung, infect the liver, and other part of the body, even the meninges. So to manage the extraintestinal amoebiasis, chloroquine is a drug of choice. Chloroquine is also used in the management of some autoimmune diseases like rheumatoid arthritis, usually treated by the NSAID, and the chloroquine is supplemented with NSAID when the NSAID does not work or it needs some supplementation. The rheumatoid arthritis management is done by chloroquine too. Discoid lupus erythematosus, that is also managed by chloroquine in the management. Chloroquine is one of the management of discoid lupus erythematosus. What is the mechanism of action of chloroquine? Chloroquine specifically binds to heme. Heme is a part of hemoglobin. Hemoglobin is a part of the RBC that carry oxygen, preventing its polymerization to hemojoin. Heme cannot convert it into hemojoin. So it prevents polymerization of the heme to hemojoin. The increased pH and accumulation of heme result in oxidative damage to the membrane, leading to lysis of both the RBC or erythrocyte and the parasite. What is the mechanism of chloroquine toxicity? Chloroquine blocks the synthesis of DNA and RNA and also has some quinidine-like toxicity. What is the mortality rate of chloroquine? Chloroquine mortality rate is around 10 to 30% in overdoses of chloroquine, and it is very common to those countries where malaria is very much prevalent. What is the pharmacokinetic of chloroquine? Chloroquine is highly tissue bound and is eliminated very slowly from the body. The terminal half-life of chloroquine is 2 months. What is the lethal dose of chloroquine for an adult? It is 30 to 50 milligram per kg. In case of children, if a children just get 1 or 2 pill or maybe 3 pill, they may die. Even at the dose of around 300 milligram pill may kill a small child. So what are the adverse effects of chloroquine? At high doses, it causes gastrointestinal disturbances like that of diarrhea and the cramp in the abdomen. That is a possibility. Okay. Skin rash, headache, blurred vision, Irreversible blindness, there is a possibility. So a person taking chloroquine should have ophthalmologic consultation. Auditory disturbance, agitation, neuromuscular excitability, discoloration of nail bed and mucous membrane. Because this medication in the body, it has a affinity for the melanocyte producing cell of the skin and other part of the body. In severe chloroquine overdose, there will be convulsion, coma, shock, respiratory and cardiac arrest, death, sinoatrial arrest, depressed myocardial contractility, QRS and QT of ECG or EKG, interval prolongation. There may be heart block, ventricular arrhythmia, and that is augmented by occasional hypokalemia. Does the FDA approve chloroquine for treatment of COVID-19? No. There is no evidence that taking chloroquine is effective in the prevention and cure of COVID-19. Okay. Several months back, at the beginning of 2020, last year, FDA approved chloroquine use in a very much controlled environment, but eventually FDA does not approve the chloroquine. Now it is not on approval list. Does the CDC recommend chloroquine for the treatment of COVID-19? No. Potential benefits of chloroquine does not outweigh its risk. Okay, so that's all about the pharmacology of the chloroquine and its therapeutic indications and its possible indication in COVID-19, but there is no evidence, so it is wise not to use chloroquine in the management of COVID-19. So thank you all for watching my video. Please share the information with your friends. If you have any question, please feel free to ask me. And please support my channel. Please subscribe me. And have a nice day. Bye now.